New wrinkle to the Affordable Care Act is playing out in living rooms across the U.S. That's where families are trying to determine what to do after being told to put their kids on Medicaid.
Now, these are middle-class families who had medical insurance, but they are just learning that they cannot afford individual plans under the Affordable Care Act. National correspondent Christine Prezau explains for us.
What letter does Alice start with? A.
The Affordable Care Act has a beginning, but unlike children's books, the introduction is not inviting for a growing number of families across the U.S.
What do you think about that, about putting your kids on Medicaid?
Well, I don't want to feel like I'm the lowest class citizen in this country. I mean, like, who is on Medicaid?
Medicaid is health care for the needy, and the Benjamins are not impoverished. Rachel Benjamin was stunned to learn under Obamacare that 5 of her 6 kids needed to go on CHIP, Medicaid for kids.
Now I'm going to just hope and pray that they're not going to need to go to the doctor.
Hope and prayer are a long way from the Benjamins' current private health care plan that no longer meets the requirements of the health care law. The Benjamins' current policy is expensive at almost $1,800 a month, but it covers everyone.
Sure, people can purchase separate policies without subsidies under the Affordable Care Act, but the minimal cost for the Benjamins' 5 kids, $16,500 a year.
Now you're talking money.
For insurance broker Ed Kafis, it's heartbreaking for him to tell families to put kids on Medicaid.
That's why I'm so incensed.
It's a wrinkle in the health care law that even insurance companies were not aware of until Kafis picked up the phone.
They didn't believe this is happening, so I had to send them a series of cases.
So what's wrong with Medicaid? Critics tell us try to find a doctor that accepts it.
I wouldn't put anybody's kids on Medicaid because it's a one-size-fits-all program that is a bureaucratic mess that really is a safety net. It's not supposed to be health care of first choice.
I don't even know what we're going to do.
The system is based on a financial formula that all insurance brokers like Kafis know, and it determines whether or not kids get separated from their parents' primary policy. I'm Christine Prezau.